Craziest doctor story you will ever hear. Last week, and this is a true story, by the way. Last week, we were driving to Columbus, Ohio for a graduation party. Now, this is about a 3-hour drive for me coming from Toledo, Ohio. I had my two parents with me. They are older and, in their 70s. So we're driving down and we're almost to this park in this place called Gahanna, Ohio, or New Albany, something like that. We're driving, we're pulling up, we're like a mile away. We're in this place called New Albany at this point. And we were driving in there and traffic starts to kind of like really slow down. I'm in the right side. It's a 2-lane, there's one lane coming at us and we're going the other way. Traffic kind of stops, everybody's stopped. And I see a car like across the median, kind of in the other lane, just stopped. Then the traffic from the other side stopped and people are kind of getting out of their cars. I'm like, whoa, what is going on here? It was a little bit shocking, obviously not a lot, but then I looked to the side and there's a guy that was on a bicycle that is face planted on the ground with his bike still between his legs, and he's sitting in a pile of blood. So boom, I put the car in park right away and I jump out of the car and I'm running over there. And I notice a guy out of the back of my peripheral vision kind of doing the same thing the guy from behind me. So I get there pretty fast, I'm pretty athletic. I run there and this guy's on the ground face planted on his left side, and there's a pile of blood kind of on the concrete, on the asphalt. And this other guy gets there with me and he's like, hey, I'm a doctor. I was like, oh, cool. I am too. He's like, oh, wonderful. So I was like, what kind of doctor are you? And we're not having this conversation. We're trying to take care of the patient. Like, this didn't stop us. He's like, rads. And that's doctor speak for radiology. So I did the same thing. I was like, cards, which is doctor speak for cardiology. And so we look at the guy, he's kind of face planted. And, your doctor instincts kind of just take over. So I was like, hey, lift his leg up. I'll get the bike out. So at least we can kind of evaluate this guy a little better, because his legs were kind of like, the bike was there and his legs were kind of mangled. And there's this white car still kind of standing there in in the road that looks like it's going the wrong way. And there's this little old lady kind of standing there, maybe answering questions or whatever. More about the old lady later, but there's this other lady on the phone calling the police or an ambulance, and there's two other people in the front saying, we saw everything, two, ladies on the other side. And we're like, we got this, we're all doctors here. So we get the guy kind of on his side, and I'm holding his neck. I'm stabilizing his neck, in case something happened to his neck. You got to stabilize the neck. He is breathing, and we notice he's definitely breathing, not really responding. We checked his pupils and they weren't shot. That terminology usually means if their pupils are dilated and they're shot and they're not reactive, usually means you had some severe brain injury. So he definitely did not have that. He was not talking though, but the bleeding had stopped. So when he hit the ground, it seems like he must have broken something in his nose or whatever. And the bleeding kind of stopped. So we've got him kind of on his side and we're holding him there. I'm holding his neck, stabilizing, and I've got my hands on his chin. There's blood everywhere. Obviously, when you're in doctor mode, you really don't care. We got blood on our hands, on my pants even at some point, and we're just taking care of the patient. That's generally what you do. Now, my dad walks over. He probably tried to run, but he's not, he's old. He's in the 70s. He walks over and I was like, Bubba, we got two doctors here. We're good. He's like, oh, cool. And I was like, we got radiology, we got cardiology, we got rads and cards. I said that, and he's a doctor too. So he's like, oh, and the radiologist looks up and he goes, what are you? He goes, gen surg. So that's also doctor speak for general surgery. So now we got rads, cards, and gen surg on the case. We've all actually done like tons of ER and trauma, stuff. Actually, myself personally, I wanted to be a trauma surgeon at one point. So I had done a lot of trauma surgery rotations in the ER, and I had this amazing mentor who was a trauma surgeon. It was fantastic. So anyways, we're stabilizing the patient and the lady's on the phone. We're kind of waiting for an ambulance to show up, right? And we hear sirens. We're like, okay, cool. Now you can kind of tell from the siren that it probably wasn't an ambulance, but we asked. My dad's still standing up. We're on the ground, holding this guy, making sure he's breathing. The radiologist is checking the radial pulse, and I've got the carotid pulse. We're making sure he's got a pulse and he's still breathing, which he is. Every once in a while, we check his eyes. The one eye that he kind of like fell on eventually got kind of puffy and we couldn't really open it as much. So we were checking the right eye. The sirens get louder and louder. I asked my dad, I was like, Papa, what is it? He's like, oh, it's a police car. Police car comes up and the guy comes out, he's got his uniform on, puts his gloves on. He comes over and he's like, okay, guys, back off. We're like, listen, stop. We're 3 doctors here. We're good. We got this. Just call a truck, call EMS. He's like, oh, sweet. All right, good. Well, hang on. And then he looks around a little bit. He's like, he grabs his little microphone on his side and he's like, I need a, whatever it is. I don't know what they say. But he walks over and he's like, did anybody see what happened? And the two ladies were like, yeah, we saw what happened. And that old lady, the lady with the white hair and the white car is like really distraught. And, looking on, absolutely horrified, right? So we still have no idea what on earth happened. We're not like investigators. We're not the police. We're just trying to make sure this guy stays alive until an ambulance comes and they put a neck brace on and, whatever they might do. Get him to a hospital, CT his head really first and foremost. The rest of them seemed fine. So we are still waiting. And out of the right side now, I hear sirens. And they kind of sound similar. I'm like, Bubba, what have we got coming on the right? It's like, I can't see it yet because there was a traffic circle and that traffic circle had been stopped and the other sort of traffic circle on the other side had been stopped. Now cars are kind of lined up on both sides, stopped with this little car kind of in the middle. We're on the side of the road here and both traffic circles have stopped. Pedestrians have stopped and kind of like told traffic, go by, this area is like locked down. The other sirens get louder and louder. My dad's kind of looking and then I was like, Bubba, what is it? And he looks, he's like, police. Because it kind of sounded like the other one. We kind of knew, but we were hoping for better. So I look at the radiologist. I was like, are you from around here? He's like, yeah. I was like, New Albany's a nice area, right? He's like, yeah. He's like, I live down this, less than a mile away. I was like, oh, okay. I was like, how long does it take? Is there a nearby hospital? How long does it take for an ambulance to get here? He's like, it should be here quick. I don't know. Now to us, it obviously felt like an eternity, but I'm sure it wasn't that long. And I don't remember. He asked me, he's like, what are you guys doing here? Where are you from? I was like, well, I'm not from around here. I'm from Toledo, Ohio. He's like, oh, really? What are you doing? I was like, well, we're here for a graduation party. We're supposed to go to some park called Hannah Park or something to that effect. He's like, oh, that's cool. It's just down the street. You hit the next traffic circle, hang a right. It's right there on your left. Like, oh, okay, cool. Well, thanks for the directions. But we're holding the guy still. And then we hear a different kind of siren. 2 other cop cars had shown up, that one siren. And then we hear a different kind of siren. So the cops are kind of moving around. The one guy is talking to people. The other guy took the old lady and was talking to her. So we still have no idea what's going on with this old lady or who she is. But the whole time we're trying to see if this guy can talk. So we're like, hey, are you awake, sir? Are you awake? Because we kind of noticed he's still breathing. He's still got carotid pulses. Rads was checking radial pulse, Rads radial. And finally he started kind of saying something. So I was like, hey, sir, what's your name? What's your name? And he was like, money, money, money. We're like, money. And I completely changed the name because obviously I don't want to give it away for privacy. He's like, money, money, money. And I'm like, your name is Money? So the radiology Rads reaches into his back pocket and pulls out his wallet. Now the cops had already taken his driver's license. So he just pulls out a credit card. His name's actually Johnny. So we're like, oh, Johnny. And obviously I'm just making up this name, but he's like, Johnny. And he's saying money, 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 which means he's regaining consciousness. He's waking up from his concussion, but he's still not getting the names right. So again, I start hearing sirens and they sound differently. At this point in time, we asked the owner of the white car, which happened to be the old lady, to pull her car off to the side so an ambulance can get in there because it was completely blocking almost, that whole side of the street. So she had pulled her car off to the side where there's a bunch of gravel, like a big kind of open area. It was like a circle of gravel. So she pulled up into there and the cops were talking to her, right? We hear a different kind of siren this time. And I look at my dad and I'm like, well, what is it? He's like, I don't know, I can't see it yet. So we're waiting. We're talking to this guy and he's kind of regaining consciousness. Pupils, still not shot, doing real well. He's starting to kind of talk and he's like, where am I? What happened? We're like, and the Rads was like, hey, you've been in a trauma. You've been in an accident. We're trying to help you. Looks like you're going to be okay. We're waiting for an ambulance. You're going to be fine. And I was still holding his neck, obviously, keeping his mouth open, making sure he's breathing, making sure he has a pulse, all of that. And looks like he was doing really, really well. Finally, that siren gets a little closer. I'm like, Bubba, what is it? And he's like, oh, it's a fire truck. I'm like, oh, geez, a fire truck. I was like, we really just need an ambulance. We just need like a truck or a bus. I think they call it bus in EMS world or ER world. So no bus yet. Fire truck pulls up and like literally pulls up right next to us. And we're like, great, now they're obstructing the road. But boom, right behind it was an actual ambulance. So we're like, oh, good, finally, an ambulance. Fire guys get out and they ask us a few questions. We're still holding the patient down. And they're like, does anybody know what happened? What happened? We're like, it looks like he was hit by a vehicle, it seems, because we kind of were hearing the backstory from the 2 ladies that were like, oh, we saw it all happen. We saw it all happen. Seems like he was hit by a vehicle and it landed, face planted his bike, his face and bike onto the ground. They're like, oh, okay. So they were like, doing their initial assessment. The EMS guys, the ambulance guys get there. They ask us similar questions. We're like, here's what happened. The 3 of us are doctors here. You got Rads, Cards, and Gen Surge. And we didn't really introduce ourselves as the actual specialty fields, but that's who was there. We're like, you got 3 doctors here. We stabilized him. He's got a pulse. He's breathing. He's starting to regain consciousness. He's talking. This whole time, he wasn't really talking or saying anything, but now he is. And, he's obviously doing a lot better. So they were like, okay, cool. They take over. They kind of like had gloves on at this point. They put a neck, brace on. The guy was actually getting up and trying to like move around. He's moving his legs. He's like trying to get away. We're like, listen, sir, just relax, calm down. You were in an accident. We're trying to help you. Just relax. Let them put this thing on you. They cut off most of his clothes, or the top at least, like the shirt and jacket or whatever he was wearing. He was wearing these really thick gloves too. They took off all that stuff, got the neck collar on, got him onto a stretcher. Looked like he was doing very well, neurologically intact, all of that. To me, basically, from what I saw, he like face planted kind of like this. So I'm thinking he has like a nose fracture, maybe an orbital fracture, because this part of the eye, the eyelid on this side was starting to get puffy and was really hard to open this eye. But that's probably what happened. I would guess he, broke maybe his nose and some of his orbit or cheekbone, whatever they call this kind of bony area. So that's kind of what happened. So back to this old lady, right? She's still sitting there. And we kind of heard when the cops were talking and those two other ladies that had stopped that maybe she's the one that hit him. So we're like, oh, so, okay, that's good. So anyways, they're clearing the scene. They got the guy in the ambulance. We tell him he's going to be all right, whatever. And so the three of us are looking at each other. We're like, well, looks like he's going to be all right. But maybe she's not. She's sitting there in her car on the corner. Everyone's kind of ignoring her, not talking to her anymore. Looks like she's filling out some paperwork, maybe writing a statement. So we're like, yeah, we probably better go talk to her. So we go up and talk to her. She's probably like 80 years old, 78 to 85. That would be my guess based on just how she looks. I see lots of elderly patients, so my guesses are pretty accurate. So I'd say somewhere between 78 and maybe 83 is her age. Just a random guess. Could be way off. Could be 90. I don't know. Or it could be 65 and just looks much older. We walk over there and I'm like, listen, ma'am, I put my hand on her shoulder. I'm like, listen, he's going to be okay. He woke up. He's talking. He knows where he is. He said his name. He looks like he's going to be fine. She thought she killed this guy. Like she literally was under the impression that she injured this guy severely and maybe killed him. And then my dad said a few kind words. He's also older. And then Rad's also kind of was there, for support. I think he might have said something. I don't know. But we told her, listen, he's going to be okay. She was kind of sitting there writing a report, for the police of like what exactly happened. I don't know, couldn't read it really. That's not my concern. My concern is making sure everybody's okay. That's kind of like that instinct when Dr. Mode takes over. Now, I don't know whatever happened to the gentleman afterwards. Based on my assessment and everyone else that was there, he's probably fine. They probably CT'd his head and neck, maybe the rest of his body to ensure that nothing was broken. There's no head bleeds, nothing serious going on. And he wasn't wearing a helmet. Unfortunately, I would highly recommend people wear helmets, especially if you're riding on a road. And, it's not your fault. The bikers are usually okay, but it's the other people around you that you need to be concerned with. So I highly recommend that. But generally speaking, it's a very sad situation, but also the fact that 3 doctors showed up. Oh, and the old lady says, she goes, we told her, we're like, listen, the 3 of us are doctors. He's going to be fine. We checked him out. He's talking. He's pretty much wants to get up and go home. She's like, oh my God, God saved him. God protected him. You 3 are doctors. That's amazing. Something to that effect. And we're like, yeah, really, we're really happy to be here. We lucked out. He lucked out, what have you. And I just feel, very blessed and very happy that we have this kind of training and we can react in this type of situation and in this type of way without even thinking about it. It's just second nature. So I hope you guys enjoyed this kind of slice of my life. This doesn't happen very often, but when it does, you got to be able to react. If you want more great cardiac and health advice, follow me.